Let's turn our attention now back to the coronavirus because the U.S. reporting more than 3,400 deaths from the virus on Wednesday. That is another record. This coming even as hospitals and nursing facilities rush to vaccinate frontline workers for a third straight day. Meanwhile, we've got the FDA panel today beginning its review of Moderna's COVID vaccine. Let's bring in Dr. Patrice Harris. She is the CEO of eMed. And doctor, it's good to talk to you today. I want to start by talking about the rollout of the vaccine for Pfizer, because there's some concern right now when you look at the Northeast, because of the storms, the ability to be able to vaccinate at the rate with which they need to be. And I'm curious if you have any visibility on that front, whether those conditions have hindered the vaccine rollout at all.
Well, thank you for having me back on. It's good to be on in my role as CEO of eMed. And certainly it's so important that we get vaccines in the arms of everyone. And clearly, as I thought about the storm, I knew that there may be challenges in logistics, but here's what I do know from the reports is that from the very beginning, companies and the government and states were talking about logistics. And so it's been reported that they have plans in place to address some of these issues. And there are going to be delays from time to time. We can't control everything, can't control the weather, but based on reports, there are plans to get these vaccines to the states so we can get everyone vaccinated.
And to your point about the logistical complications, it does seem like despite all of the concerns, even before the vaccine rolled out about the cold storage facilities being available and the ability to inoculate people in the way they need to be, the storm aside, things have been rolling out fairly smoothly. What have you observed so far, and where are you in the process right now?
Well, I have observed that. And of course, as a physician, I'm an interested bystander, particularly as an African-American physician. I want to make sure that I talk about the importance of getting this vaccine when it's your turn. I absolutely plan to get the vaccine when it's my turn. And so we will let the experts, the logistics experts, get the vaccines to the states. The states, of course, will determine the schedule. But again, we certainly need to get the vaccine into the arms of everyone who wants that. That being said, there's lots of promise around vaccines, but we know that we are going to likely not see everyone vaccinated until mid-June. And that's why it's so important for us to continue to do what we know works: masking, watching your distance. And a critical piece of the work that we continue to do is testing. And that's why I'm so excited about eMed. eMed saw a problem early on in this pandemic: long lines, people waiting days for results, having to drive to centers. And that, of course, would preclude anyone that didn't have a car. So looking at these barriers, including some of these social determinants of health, eMed saw that as a problem and certainly worked on a technology solution, sought out a partnership with Abbott. And that's why we are so glad, again, to be introducing eMed's digital point of care as a problem solver, making sure we get the tests to as many folks as possible, and tests that are affordable.
Yeah, Dr. Harris, I'm glad you mentioned all those pieces here, too, because all of those have kind of been aspects as to why we've seen problems in communities of color. Not necessarily those are the only reasons here, but when we talk about testing and the problems there, you can talk about homeless populations. It seems to be an issue in California. I mean, just the numbers coming out of California right now, of course, we can get into vaccine down the pike and how that's going to be helpful later on. But just right now, 24% of the daily cases are coming from California, despite only having about 12% of the U.S. population there. We've talked about how communities of color right now in California, the Hispanic population, getting hit pretty hard here when we think about where cases are popping up. How much of that tends to stem from testing issues versus just what other, reasons as to why that might be happening right now, and how much of that needs to be emphasized when we think about rolling out the vaccines to some of these hard-hit populations?
We've seen that disproportionate burden on communities of color since the very beginning. And we've seen that regarding the burden of disease. And we saw that regarding the accessibility of tests. And so, again, as we look at all of these issues, we need to appreciate the disproportionate impact on vulnerable populations. And everyone needs to redouble, triple our efforts, do all that we can. There is no one size fits all solution, no panacea, but do all that we can to, as we say at eMed, democratize healthcare, make tests affordable, accessible. And this solution that we have in our partnership with Abbott brings that home. And again, it doesn't solve all problems, but clearly it solves a lot of the challenges regarding testing. And our solution is at home, end to end, from registration to taking the test. We have certified guides making sure that people do the test correctly. We want to make sure these tests are validated, right? And we want to make sure the results are validated. So a good process, a good result. And by the way, I take my test regularly. And here is an example of a completed test. And the other, I think, very critical piece of our solution at eMed is that we offer a digital certificate. And so once I get my negative results, I'm using my Face ID here. I don't know if you can see it. I'll try to hold it up to the camera, but I have a QR code here that shows my results. So we are very excited about, again, democratizing healthcare, doing all that we can to make sure that as many folks as possible have access to this test, but in the comfort of their home, in addition to the lines and the delays. Again, you get your results in 15 minutes here, but also going somewhere to get a test, risk spread of the disease. So all of these.
Dr. Harris, I want to jump in here because I think for all the talk about democratizing the test, I will tell you as somebody who's in California right now, where Zack pointed to, seeing huge surge, it is incredibly difficult to get a test at a very timely way. There are lines outside the clinics. There are those that don't cover specific insurances. People are waiting 2 hours line in some instances. And I'm wondering, for all the talk about testing, why we are still at that point right now, 8 months into the pandemic. I mean, is there something that you can point to that you think is not being done that could maybe allow for a little more efficient testing and encourage people to actually go out and get tested? Certainly people don't want to be waiting 2 hours in line if they want to get tested at a very frequent pace.
I agree. And that is our solution. That is our solution. You don't have to go anywhere. You can register through the Navica app, get your tests, get the test, the Abbott test, shipped to your home within 24 hours. And then you get online and are guided through that test by our proctor. You get your results in 15 minutes and you have a record of your results. So the problem that you just noted, the long lines and inability to get tests, that's a problem that we plan to solve. And we expect in Q1 next year to distribute 30 million tests. And so, again, that's a problem that eMed is committed to solve. We have this exclusive agreement with Abbott, but certainly going forward, we want to think about this with other tests and thinking about this globally.
No, it's very important. And to Aikiko's point yesterday, I'm just very glad that I don't have to stand in those cold lines in New York anymore. At least that's one positive for people in California right now. But appreciate your time. Dr. Patrice Harris, eMed CEO, thanks again for joining us.